Good afternoon, good evening. Thank you so much for joining us for the Mpox special briefing from Africa CDC. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Joining us today is the Director General of Africa CDC, Dr. Jean Kaseya, that will be presenting on the situation analysis of the health emergencies across the continent. I will now hand it over to the DG to start the session. Over to you, DG.
Good morning, good afternoon, good evening to all of you. As our director Margaret is saying, our weekly briefing is not just on Mpox, but it's also to brief you on all public health events in Africa and to see what Africa CDC and partners are doing to mitigate the impact of these outbreaks and also to prevent the occurrence of a pandemic, because this is very serious. We'll discuss that. Let us start with the presentation, please. Next slide. Next slide is about the AU Assembly that ended a few days ago. It means on Sunday. And one of the major outcomes of this AU Assembly is the decoration that was given, the award that was given to Africa CDC for the work that we are doing. And it's also, we wanted to celebrate that with you, colleagues, journalists, because you are those who are helping our countries to understand and to be informed about what Africa CDC is doing to support them. On behalf of Africa CDC colleagues, we want to thank you, because it's for the first time that the Director General of Africa CDC is getting this award from the AU Assembly. And we believe that with this confidence that our member states are giving us, we'll continue to perform our role and to protect the continent and the world. Let me also update you that there are a number of decisions that were taken during this AU Assembly to support what we are doing. The first one is the African Epidemic Fund is finally approved. And we start now to operate under the Africa Epidemic Fund. It means this is the vehicle where we can receive funding without any limitation, without any bureaucracy, to use that to support African countries to prepare and to respond to outbreaks. And this is amazing. We are celebrating that in Africa CDC. The second one is the strong support regarding the agenda of local manufacturing in Africa. With COVID, Mpox, Ebola, Marburg, we saw that we didn't have all medical countermeasures we were looking for. But what is also the good news? The good news that today we finalized the negotiation with Bavaria Nordic for the tech transfer to African companies. Even wanted to sign during the AU Assembly. We are requesting a few days of patience. We'll give you the name of the company, and we'll send in South Africa, already discussed President Ramaphosa to host this ceremony to sign the tech transfer from Bavaria Nordic to an African company to manufacture Mpox vaccine. This is what we need to do now for all outbreaks in Africa. And we cannot talk about all of these aspects without talking about the innovative financing mechanism. And as you know, we had the meeting on the 14th of February, led by President Kagame, with attendance of around 10 heads of state, and a number of people were invited to discuss the outcome of an analysis that Africa CDC conducted and the risk of not having funding because of the decrease of funding at the international level. And that one led for a strong decision to allow Africa CDC to start with the innovative financing mechanism. We are putting in place a committee that will work on that in the next few weeks, we'll come back to you on the way we are moving this agenda. Next slide, please. Okay. No. Okay, next slide. Okay, thank you. Today, we are starting with an update on the Ebola outbreak in Uganda. As you know, we had 9 cases. Africa CDC is supporting strongly Uganda. We provided medicines using what we did, like in Rwanda, when Rwanda had Marburg. We learned from this process. Currently, I'm talking to you. Our director of science is still in Uganda with a team supporting Uganda. We supported Uganda to start with that together with WHO, the vaccination, and we are glad to see that for Africa start not to have this case fatality rate lower than what we had before. Because if you can see, out of the 9 cases that we had, only 1 death and 8 are now out of hospital with their communities, but we are still following. And now what we are doing is to ensure that we don't have any new case, and we are continue to do the follow-up of all contact. In total, we had 91 contacts, and we are also doing some investigation to understand what is the source of the outbreak, because we want to prevent that in the future. At least things are moving well, and we congratulate the government of Uganda for the progress they are making. Next slide, please. In Angola, we saw there is a decrease of cases. If we compare last week, we had 1,143, and that week we had 957 cases. And we saw also there is a case fatality rate around 3 to 4%. That is acceptable for now. And we are congratulating Angola because they got 900,000 doses of vaccine. They decided to put in place measures to strengthen the water and sanitation and hygiene component. And the president himself is leading the response. I was talking with the president during the AU Assembly. He was sharing information with me like he was a public health person. It means he really knows what is ongoing. And this is the kind of leadership we want when there is an outbreak, to see the president supporting the minister and all other government officials to respond to the outbreak. Now, they are requesting additional doses. Africa CDC is working to support them. Myself, I will be in Angola in March to see how we can use this opportunity to strengthen the whole health system, and that also to see how to bring other sectors that are related to the health system to ensure that we don't have another outbreak. Yes, we still don't have cholera vaccine manufactured in Africa. In 2025, our key priority will be to have a vaccine, a cholera vaccine manufactured in Africa. Next slide, please. Before talking about specific countries on Mpox, wanted to give you a kind of overview. As you know, we are still struggling with what's happening in the eastern part of DRC. We are talking about Goma. We are talking now about Bukavu, where we had this clade 1B discovered in 2023. We had more than 400 active Mpox patients admitted who are now out of the treatment center. We don't know where these people are. We don't know what kind of damage it will bring in a few days. We are worried. I was talking with the president of Tanzania, who's leading the joint mechanism, SADC and Eastern African Community, on how she can help us. first, to bring commodities in these two regions, and second, to give us access with security to retrieve these people and to continue the program that we had. For other information, you'll see it when I will go through other slides. Next slide, please. This week, if we compare to the previous week, you will see some changes that we have. There are countries where we see an increase of cases. There are countries where we see a decrease of cases. We will start with where we see the decrease because we need to start to celebrate our small success that we have, like in Nigeria, like in Liberia, like in Burundi. As you know, Burundi was one of the epicenter of the outbreaks. Now we see a decrease in terms of cases. If we compare with the previous week, we have less than 48% of decrease in terms of cases. But we still have countries reporting more than last week. You have Congo Brazza. We saw that last week we had 2 cases. This week we have 12 confirmed cases. We like in Zambia, we had 2 cases. This week we have 16 cases. And yes, still DRC. Yes, still Uganda. We are now focusing on these red countries while we are supporting countries with a number of cases that are decreasing to continue with this trend. Next slide, please. The situation in the eastern part of DRC, I already spoke about it, but I want also to draw your attention on the fact that in this region, we have more than 1 million people displaced in Goma, more than 153,000 people displaced in Bukavu. We want also to say we have cholera outbreaks there, we have measles outbreaks there, and we don't know what will be next. I think all of you saw the letter that I sent to all heads of state in Africa on the 28th of January, calling them to stop what's happening in the eastern part of DRC, because that one can become a major issue for the continent in terms of new outbreaks that can spread everywhere. And also, I say that can be the entry point for a new pandemic. And we are very serious when we are saying that. Next slide, please. In DRC, you will see for the past a week, a kind of decrease in terms of cases. But this decrease in terms of cases is not the reality. It's not the reality because all regions affected by insecurity are not reporting today. This is the first one. The second one, in terms of confirmation, what we call the confirmed cases, you will see that we moved from 48, we started to make progress to 28%. And you'll see reasons, including stop of funding or pause of funding from the US. And we'll discuss that with you because it's time now to accelerate. Yes, in other regions, we see the decrease because we did our best to provide support for vaccination, for IPC, for surveillance system. But in other areas, we are still struggling because we don't have appropriate information. Next, please. And this one is to give you a clear example on what I'm talking about confirmed cases. You'll see in a region like South Kivu, like North Kivu, and other places, we don't have information because either insecurity or pause from the US government funding. because the mechanism that we had in place in terms of sample referral was mostly based on the US funding provided to DRC. The combination between insecurity, lack of funding, lack of medical countermeasures, I have to say to our leaders, even during the AU Assembly, we are playing with fire. We are playing with fire. Because if we don't reverse this trend, Africa CDC is every day saying, please let us stop. Let us provide more funding. Let us provide access to people with some security. And let us provide more medical countermeasures. That one, the world can do that. We don't understand why it's not possible today. Next slide, please. In Congo, Brazza, as you can see, I was talking about it, there is an increase in terms of confirmed cases. Next slide. And it's just to show to you that where we have these cases are mostly where you have the concentration of population in Congo, Brazza. Brazzaville, Pointe-Noire, that is the second city, and even the economic city, and then Cuvette West and Cuvette. It means the outbreak, the disease is where we have more people who can also contaminate other countries, because Brazza is neighbor to Kinshasa, they can contaminate each other, and because we know also other regions like Cuvette and others can be in contact with other places in other countries. Next slide. Yes, I already discussed that for Congo Brazza. Next slide. In Uganda, we don't just have Ebola, we have also Mpox. As we saw, there is an increase in terms of cases. Now, Africa CDC, with our new strategy, we are not just targeting one disease. We are coming with a comprehensive and integrated approach. Like in Uganda, we are supporting Mpox, Ebola at the same time. And in other places where there is an outbreak, we are going with all other diseases. Next slide, please. In Zambia, we have cholera, we have Mpox. We are also doing the same because we see an increase in terms of cases in Zambia. And I want to thank the president of Zambia, who's also following what's happening in his country. We had a good chat during the AU Assembly, and we have colleagues in Zambia providing strong support. I think Zambia is taking also action on this issue. Next slide, please. It's just to let you know, like in Congo Brazza, the concentration of cases is mostly in the capital, Lusaka, where you have all people coming and going. And this is the hub for the country. And we need to continue to provide strong support and to avoid to see this outbreak spreading everywhere. We already have, you see the map in the Copper Belt, where you have the Kappa, and it's where Zambia is extracting Kappa and where you have so many people. And this one is also neighbor to Katanga in DRC. I think this is why we are supporting the cross-border activities to see how we can stop this transmission. Next slide. We started, and as I said, we are celebrating the tech transfer of Mpox vaccine in Africa. But with what we have, we already provided vaccines to 7 countries. 5 countries are conducting vaccination, and we already provided more than 200,000 doses to people in need. I think our collaboration with European Union, with Bavaria Nordic, with other countries is really ongoing. We are talking with the US government for doses that they committed to provide to us. We believe that with the new administration, we'll accelerate this discussion. Next slide. We cannot talk about surveillance. We cannot talk about the progress we are making without talking about lab. The centralization of lab is one of what we call the Mpox legacy. Look how we started in DRC. In December 2023, we had 2 labs with qPCR for Mpox. In December 2024, 12, we made huge progress. Africa CDC, I can say, we supported at 90%. We bought this qPCR, we trained people, we provided support to DRC. We moved from 2 to 12. Now we are talking in February 2025, we moved from 12 to 19. And what do we want? We want to cover DRC totally. It's not just for Mpox. Please don't forget the disease X. That for 2 months, we had an outbreak somewhere. No one knew what was this outbreak. We don't want DRC to become the epicenter of another major outbreak, even a pandemic, without knowing what is going on there. This is why the new approach of Africa CDC to decentralize lab, we started in DRC, will continue to all other countries. And this is a clear example of what we are doing. If people they want to know what Africa CDC is doing, just take a photo of this slide, show to people what Africa CDC is doing. Next slide, please. In summary, as I was saying, we made progress in many areas, but we still have challenges. Security issue, funding, especially the pause and decrease of funding from other Western countries, lack of medical countermeasures. This is our call to say it's time for us to stop all of these outbreaks. We made progress in Ebola. We made progress in Marburg in Tanzania. We made progress in Marburg in Rwanda. We made progress in cholera in many Southern African countries. Now it's time to stop this Mpox outbreak and all other ongoing outbreaks. Thank you to you, and back to you, Margaret, for questions.
Thank you very much, DG. Let's cross over to the floor for the first question. Janice from Bloomberg, you have the floor.
Hi there. You can hear me?
Yes, Janice, we can hear you.
Great. I have a couple of questions, but they're all related. So I'm going to go for all of them because, as I say, they link to each other. At the beginning of the briefing, you were speaking about the local funding after the AU summit and you know, the epidemic fund, which is fantastic news. And in light of that, last week, we heard on the briefing that China and Korea have sent money to plug some of that health funding gap. And the questions are all around that. I was wondering if you could let me know how much funding has come from those 2 countries, if you could confirm that that funding is to replace some of the funding that's been lost from the US. Dr. Ngashi spoke about 84% of the healthcare money coming into Africa, that the Africa CDC needs to find funding for that. And I was wondering how much of that 84% for Africa was from the US. And then looking at, you know, foreign investment in African health has been dropping for 4 years. And, you know, this is why Africa CDC has been working to set up the epidemic fund and, you know, housing some of that leftover COVID-19 money to help fill these new gaps. But I was just wondering if you could give some more detail around, you know, the local health financing that was raised at the AU summit last week. Last week, we we also heard that there were talks to engage the private sector, and I was wondering if you could say which organizations are part of those talks. And there was also a comment around a gap analysis that was being conducted in member states over the course of last week that would show where the most urgent needs were. And I was wondering if that gap analysis had been completed and what had come of, what had been found in that analysis.
Thank you very much. DG, over to you, as it's a number of questions.
Yeah, we can even end the interview with just these questions. Okay, thank you, Janice. Yes, last week, the AU Assembly wanted to send a strong message to African member states and to our partners by saying clearly, we trust and we support our Africa CDC. It was Africa CDC everywhere. And let me confirm that, yes, we got money from China and from Korea. We got, for both of them, we got around $4 million. And, but it cannot replace the one, the commitment from the US government. Let me remind you that the commitment from the US government was more than $500 million. And what my colleague Chanel was leading operations and finance provided to me, we got around 380 committed, not in the field. And you see, we are far from filling the gap. And we are talking with the US government to say, this is one of the life-saving interventions, and you decided to provide a waiver. Let us accelerate this agenda. Our security is your security issue also. And I think that one will be a strong message. But also during this AU Assembly, we have a country like Morocco. They clearly said, in addition to the whole support we are providing, they pledged $2 million to Africa CDC, clearly. And my colleagues are working now to collect this money to bring back. And they even said, we will increase this 2 million. We start with 2 million, we'll increase that. And they want to make it on annual basis. You see, this kind of commitment, this is what we want. It will be part of the innovative financing mechanism we are talking about. We had also opportunity to discuss the private sector. As you know, like Africa, they provided more than $1 million to Africa CDC. And we have a number of other private sector. We are having, I had a good chat with Alinko Dangote, Tony Elumelu, and a number of people leading strong private sectors in Africa. I think the next few weeks and months will make a huge progress, especially when we'll put in place this innovative financing committee in place to start now to go on more comprehensive way on this approach of innovative financing. Thank you. Back to you.
Thank you, DG. Let's take the next question. Sarah Jeving from DVEX, you have the floor.
Very much for the briefing. To follow up on that a bit, can you please provide more details on kind of functionally how the African Epidemics Fund will work? How will fundraising work? How can funds be accessed? Who can access funds? How will govern, who governs this fund? Is it immediately operational, or is there kind of steps that need to happen moving forward? And then how do you think it will change the way Africa responds to outbreaks? Thank you.
Thank you. Over to you, DG.
Many thanks, Sarah. Long time. Happy to have you back. And yes, I was talking about African Epidemic Fund because this one is a game changer. A game changer because we can immediately receive funds. We can use this fund without going to request any permission from any AU organ. We can use this fund on the purpose that is in the document. It means preventing, responding, and also building resilient systems. And that one is the flexibility that we're looking for. And we have Africa CDC as the secretariat. It means Africa CDC will start to lead, this fund, but we have a board, and I will share with you through our Director Margaret the document on the African Epidemic Fund. You will see how the board will meet and to guarantee the transparency and accountability. We still have to report on regular basis to the AU policy organs because everything we are doing is on behalf of our member state. We still have to report to our donors. We still have to report to our communities. African Epidemic Fund will be in the website of Africa CDC. We want people to see on daily basis how much we are receiving, how money is used, where money is going. That is also the transparency that we are bringing in Africa. We want Africa CDC to be the, even in 2025, I think I shared that with you. We want Africa to become ISO certified. We want Africa to become the first AU organ with this level of transparency and accountability. I think AFEF will be an opportunity for us to show how accountable we are. Thank you so much.
Let's take the next question. Kerry Kallinan from Health Policy Watch, you have the floor.
Thank you, Margaret, and congratulations, DG, on your award. I have two questions. The first is, have you engaged at all with the US to try and get some of that 500 million that they've promised back? And secondly, which company is or companies are Bavarian Nordic doing the tech transfer with? Thank you.
Thank you very much. Let's take the next one before DG comes in. Paul from the Lancet, you have the floor.
Yes, thank you very much. I think the DG mentioned what I would also like to request, which is additional information regarding the structure of the epidemic fund. And so I would like to ask this question following up on the tech transfer. When there is a tech transfer, there will always be the question around who is to eventually going to pay for these vaccines when local manufacturing comes in. So what is the conversation going around actually supporting this local manufacturing so that the licensing or the tech transfer is not just a policy thing, but something that transfers into real action? Then I also want to know any insights you can give regarding the waiver given by the USAID for some emergency interventions in Africa, whether any of these waiver has been active on the continent that you can mention in this conversation. So I think if I also want to add another thing, that we've been talking about how the US policy is affecting emergency response. Do we have insights into how it's playing out regarding non-emergency health projects, for instance, let's say non-communicable diseases and other actions, health actions on the continent that are non-emergency? Thank you.
Thank you. DG?
Thank you. Let me start with Kerry, and I think my colleagues, Chanel and others, they will provide more information on the tech transfer. Yes, Africa CDC played a major role to get this waiver. The first day we got this information, we started to use the diplomatic channels to engage our US colleagues and partners to say, we respect your decision, but we need this decision on the waiver on life-saving interventions, HIV, outbreaks, malaria, and others, because that one can also impact you. Even, I think you know that I went to CNN to call, and we had to discuss with a number of other newspapers in the US, and we started to discuss officials. We got the waiver. We started now to work on the waiver, what this waiver means. It took some weeks to define the content of the waiver. We are negotiating with them about the 500 million. As I said, they already committed around $385 million. We had more than 130 million that were not committed. Now, we want first to see the commitment becoming real money on the ground, and we want also to commit the 125. Yes, we have some negotiations. I don't want to disclose what we are doing now because it's still ongoing. Please give me a few days, maybe next week or the 2 weeks, I will provide more information. But you can understand that I'm not taking this call from Addis Ababa. It means we are talking with the US government. Regarding the tech transfer, the first news is we did an open competition. African companies, they sent their submission. There was a panel that took time to analyze everything. And we had the first, the second, and the third company, even the fourth one, based on the submission they made. Now, what we are doing, as I said, wanted to sign last week, but we are still negotiating a few technical issues, just a few, because I can say at 95%, we are in agreement. The 5% remaining, this is what we are finalizing. And I cannot today give you the name of the company because if we don't finalize this 5% for the first one, we can go with the second one. It means, let me for now ask you to give me a few days, just time for Chanel and the team to finalize with Bavaria, Nordic, and African companies. That one needs also for us to have a kind of a stockpile fund. We want an AU member state to fund a stockpile. And we are working with our IMST, Dr. Ngashi, and the team to come up with a clear way we can use these vaccines with the new vaccination strategy that we have. And that one will help what we call to have a kind of predictability in terms of demand that will facilitate the manufacturing process. Chanel and Dr. Ngashi, because this is a critical issue, our colleague Jonas, they want to know more. Can you please come up and provide more information that you have? Over to you.
Dr. Ngashi, would you like to start?
Yes, thank you very much, DG. Yes, I think the most important for us is working on the demand that even if there is the tech transfer that is given to African manufacturers, I think the most important is to then ensure that the member states are ready to use the vaccines and buy them in volumes. I think that's the reason why there are many lessons that we are learning from the current response to the Mpox, but also all the work that we are doing with Marburg, with Ebola, that we are now learning some lessons on the demand forecasting in terms of how can we then predict the needs of the countries to be able to get some ideas on the quantities that might be needed. I think that is one work that we are doing. And I think we are quite advanced. You might have seen that when we started, for example, we did the initial projection of the needs in terms of Mpox vaccines. You saw at the beginning, at the end of it, the estimate that Africa CDC came up with about 10 million vaccines that were needed. We've gotten almost toward that because we've already secured about 6 million, and then we are continuing with the process, both the vaccination, but also the mobilization of vaccines. But at the same time, Africa CDC also has also gotten the approval, the decision from the African member state to establish the African Food Procurement Mechanism. As a mechanism that is going to help the member states pull their procurement together and then constitute the volumes that are important to negotiate the pricing, and then ensure that we can generate enough really to motivate the manufacturers to be able to produce for the needs of the continent. I think those are the two pieces of work that bringing together will really support very much our effort on the tech transfer now, knowing that not only that we can produce on the continent, but we do have the ability to predict our demands. We do also have the ability to pull those demands together to then give the volumes that they need. Perhaps, Chanel, you can make a comment on the tech transfer itself. Thank you very much.
Thank you, Dr. Ngashi, and thank you, DG. I think on the tech transfer itself, as you're probably aware, there are two main components. There's the drug substance component, which tends to be the more complex and sophisticated aspect of the transfer, and in many ways the more tightly held by originator manufacturers and developers. And the other part is the more fill and finish, so the late stage. And I think we at this point aren't able to give any details on either of those components, except that I think what has been publicly stated is that it would start with the latter, so start with the fill finish to begin with. And we hope to be able to provide more information in the coming period. Maybe just to note also on the stockpile that we anticipate there will of course be some, as Dr. Ngashi has mentioned, a forecasted demand and a predictable procurement of demand. But of course, since the disease may not always be predictable, the DG mentioned the stockpile. And what is envisioned there is that there would be a pooling of resources to enable the continent to have a stockpile. And then there would be African experts that would be determining the deployment and making decisions on the deployment based on the outbreak. So it really is using the African manufacturers, the African pooled procurement mechanism, a continental led and funded stockpile, including on the disbursement. It really is what the continent envisions in terms of it being able to have autonomy and agency over its medical countermeasures. Thank you.
Thank you very much. Let's cross over for the next question. Stephanie Nolan from New York Times, you have the floor.
Thanks very much, Margaret. I apologize for returning us all to the issue of the US government waiver one more time, but I wanted to make sure that I report this accurately, and I'm still a bit unclear based on the questions and the conversation this morning. Dr. Kaseya, if I've understood your response to Paul's question correctly, you were referring to the fact that the Africa CDC lobbied to have the emergency waiver process created. Were you also suggesting that the Africa CDC itself has had to apply for a waiver, or I would assume multiple waivers? And if so, could you clarify what programs you've applied for a waiver for, and if you've had any response on those waivers? Thank you.
Thank you. Let's take the next one before DG comes in. Makochi from BBC, you have the floor.
Hi. Yeah, I just wanted to confirm the conversation that the Africa CDC is having with Bavaria and Nordic in terms of tech transfer. Is it just specific to Mpox vaccines, or are there other vaccines included in the current conversation? Thank you.
Thank you. DG?
Thank you so much. Let me start with Stephanie. Yes, Stephanie, we have to say Africa CDC is not an NGO. Africa CDC is the convening power, is the public health agency of Africa. Our role is to ensure that all African countries have appropriate funding and commodities to perform their mandate. when we started to lobby for waiver, we didn't lobby for Africa CDC, we lobbied for Africa. This is the first one I want to say. Africa CDC didn't go to the US government to say, give us money. No. Africa CDC said, give us the waiver for the continent. And we are approaching that country by country. And we are approaching that for what the US as continental program like the Mpox, we are approaching that also based on the continental context. And the life-saving interventions we are talking about, as we say, we are working with the US government to continue to define that, because in the beginning we have different understanding, but I think we made a huge progress on that. Regarding the question from the second colleague, for now, our conversation with Bavaria Nordic is mostly around the Mpox vaccine. We didn't open the conversation to another vaccine for now. But there are other tech transfer underway for multiple antigens to African manufacturers, and you'll see we are accelerating the process for a number of antigens. Thank you.
Thank you. Let's take the next question from John, a health and science journalist from Uganda. John, you have the floor.
Hi, Margaret. Can you hear me?
Yes, we can hear you.
I have one or two questions on Ebola. Apart from remdesivir, what are the other treatments that health authorities are using to treat confirmed cases? And how is this? We had Ebola in 2022, same Sudan strain. So how is that the Ebola in 2022 different from this current one? And I don't know if they have talked about the sequencing, and has it helped to trace the exact source of this specific outbreak? And like we had a case in Tanzania, and then Rwanda, and now Uganda, they seem to be increasing. I don't know why these viral outbreaks seem to be, like common, like in Africa.
Thank you. DG?
Yes, let me ask Dr. Angash and the team, especially Mosoka, to respond to questions related to the treatment and other technical aspects of Ebola. Dr. Angash and Mosoka, over to you.
Yes, thank you very much, DJ. Just to say that there are three different treatments, I think, that are being considered for treatment of Ebola cases. That include the monoclonal antibodies, the convalescent plasma, and then remdesivir. But the problem is that because of the few number of cases, I think the 8 cases that have been discharged were all given remdesivir. But the hope is that if there are additional cases that will come after, then the full clinical trial will then be implemented with those 3 treatment arms. I think that is the current treatment that is being considered in Uganda. DG, with your permission, I also wanted to just add a few comments on this question of the US freeze of funding. Just to say that on Africa CDC in particular, we don't have much funding that comes from the US government, because this has come when we're seeing the process of really discussing areas of collaboration, and then the budget of the US assistance to Africa CDC. But one thing that we had already secured is the positions, I think about 11 positions that were supported through the US CDC, and all those for now were recommended to be continued, so that on that side of the HR, we are not affected. But on the response, I think it's more on the member state side that this waiver has kind of relieved a lot. given the fact that it has included what is called the life-saving humanitarian assistance, which includes the critical commodities like antiretrovirals and so on, but also interventions that target the management of emergencies, like in the Mpox response, where we had the US fund support, for example, the transportation of Mpox specimens, both in the DRC, in Uganda, it is the same thing. But I think part of the work to be done is also to ensure that that information is widely disseminated to the member state, because some of the US implementing partners, when the announcement was made in the first place, they just went ahead and stopped the funding. And that when the waivers came in, I think they haven't been fully disseminated to ensure that some of those life-saving humanitarian assistance interventions are continued. Over to you.
Thank you very much. Let's take the next question from Emery of BBC. You have the floor.
Thank you very much. My question is asked for Dr. Kaseya. The DRC was expecting the Japanese vaccine for children, the LC16. This is a pledge that was made about months ago. Is it possible to know when these vaccines are expected in the country? And in terms of the demography, are still children among 40% of the cases tested positive?
Thank you. DG?
Yes, thank you. I think we updated a few weeks ago that DRC got vaccine, even training was organized. It was before having Goma taken by M23, sorry. And even one of the calls I made, and there is ongoing diplomatic initiatives under the leadership of President Samia from Tanzania to see how we can take some of these vaccines from Kinshasa to Goma. And you will be informed when everything will be finalized in March, because we are having this high-level discussion with President of Tanzania, DRC, and other leaders to see how we can make things available. These vaccines, we need it in the eastern part of the DRC for children who are affected. I think I already shared with you that we need some guarantee in terms of security, not only for us, but for the population to access this vaccine. Over to you.
Thank you, DG. We have Dr. Fala has just joined the call. So before he comes in, I have a question from Flavia of Uganda Radio Network. She would like to know the latest about the clinical trials in Uganda. There are concerns locally that some of the contacts that were being followed finally turned positive and couldn't continue on the study. Hand it over to Dr. Fala to take that one. Dr. Fala, over to you.
Thank you so much, Margaret. I was on the call as an audience, so I'm sorry, I just shifted. In terms of, maybe we'll unpack the questions. Why do we see continuous outbreak of the filoviruses, Ebola in Eastern African region? That's a big question we're asking. The filoviruses include the strains of Ebola and Marburg. We think that there are spillover events happening, as the sequencing data indicated that this current strain was related to the 2012 strain, so it can be a recent strain for sexual transmission. And there were minimum mutations in the new sequence data, showing that it must have come from a natural reservoir. So as the first thing, we think that the Great Lake region, there are animal hosts, and so we are writing a multi-country protocol for 7 countries in the Great Lake region to go and dig into the reservoir. That protocol has been developed. We've engaged our colleagues from DRC, from Burundi, and other countries, but we think that there are spillover events that are going on. In terms of the clinical trial, almost all of the confirmed cases, including a child, were given the remdesivir under the WHO adoptive moral protocol that provide for compassionate use. So we can't draw causation because there were no randomization, but clearly 100% of the cases that went on treatment survived and were discharged on the 18th of February. As far as we know from the Minister of Health on the 18th, when she declared, all of the contacts, the 216 contacts, as of the 18th, none had become symptomatic. 91 of those contacts were discharged. And what we gathered from the scientific team in the in Uganda was those in the delay ring that received the vaccine, and that got delayed and received the vaccine, no one became symptomatic. What we last did in Uganda was to develop a 3-arm protocol that we have set that will look at remdesivir, monoclonal antibodies, and convalescent plasma from survival. That protocol was approved. I just got it today. We're going to set it up in the event there are confirmed cases that we can randomize into one of 3 arms. And that is ongoing, and the vaccine study, we have not seen any difference in immunization yet. Africa CDC is deploying a team to track the safety of the vaccine. Thank you.
Thank you very much, Dr. Fala. And with that, we've come to the end of the weekly briefing this week. I will now hand it over to Dr. Kaseya to close the session for us. Dr. Kaseya, over to you.
Yes, I know you have so many other questions. Maybe you wanted to have more time, but as we respect also your time, wanted just to share that in 2024, we did a lot. It was recognized during the AU Assembly. We still have so many challenges. We are still led by this fear of having either a major outbreak or a pandemic from Africa. And there is a combination of a number of factors. First, there is an increase in terms of outbreaks. From 2022 to 2024, we have more than 41% of increase in outbreaks, moving from 152 to 142 public health events in 2024. This is the first one. The second one, we don't have medical countermeasures in place. We are still struggling to get medicines, vaccines, and diagnostics. The third factor, insecurity, especially with what's happening in the eastern part of the DRC. The fourth factor, the pause, and even the foreign development assistance. If you compare from 2021 to 2025, is decreasing by 70%, moving from 81 billion to 21 billion in 2025. All of these factors together are clearly showing us that we could face not only additional deaths. Africa CDC is the estimate from Africa CDC is around 2 to 4 million additional deaths per year. We are estimating 39 million to be into poverty. We are estimating loss of billions of dollars in our economy. But that one is also bringing a huge risk of a new pandemic. This is why we want to continue to advocate, and we need you. We need your strong voices to say it's time for us to reverse the trend and to make this continent safe, to save also the life in other continents. I think this is our strong message, and we'll continue to talk with our member states for more innovative financing and more domestic financing.
It's 5 o'clock.
We'll continue to talk with US and other Western countries to provide more funding in another way. If they don't want to talk about assistance, let us talk about another concept, but we need this funding to continue to move forward. Thank you so much, and let us meet again next week with some update on the tech transfer, some update on the innovative financing, and some update on the progress we are making to bring medical countermeasures in Goma and other places where they need. Thank you so much.